Lymphedema. Lymphedema is hypertrophy of skin and subcutaneous tissues. This hypertrophy is due to chronic edema caused by chronic lymphatic obstruction. What is the etiology of lymphedema and the etiology of chronic lymphatic obstruction? This condition may be primary without detectable pathology, and actually primary lymphedema is congenital, and the primary lymphedema, which is congenital, is rare. This congenital lymphedema may be due to aplasia or hypoplasia of lymphatics and lymph node, and usually aplasia and hypoplasia is the commonest cause for congenital lymphedema. There may be abnormal congenital dilatation and tortuosity of lymphatics, this leading to what is called varicose lymphatics. And sure, in dilated lymphatics, there is slow flow of lymph, which is some sort of lymphatic obstruction. A rare type of congenital lymphedema is called Milroy disease. Milroy disease is a congenital lymphedema with familial predisposition. There are three forms of congenital lymphedema. First of all, lymphedema congenita, which appear since birth or within the first year of life. There is lymphedema precox. Lymphedema precox is lymphedema occur in adolescence, and this is usually the commonest type of congenital lymphedema. Congenital lymphedema may appear in late age, after 35 years old, and this is called lymphedema tarda. Therefore, congenital lymphedema may be lymphedema congenita, lymphedema precox, or lymphedema tarda. This is the primary congenital lymphedema, which is rare. The much more common type of lymphedema is secondary lymphedema, which is acquired due to detectable cause. Secondary lymphedema, which is the commonest type of lymphedema, may be traumatic like block dissection of lymph nodes, excessive removal of lymph nodes and lymphatics in the axilla. Why? In radical mastectomy, or excessive removal of superficial inguinal lymph nodes. Why? As in radical valvectomy in cancer valve. Lymphatic obstruction may occur due to chronic inflammation in the lymph vessels, chronic lymphangitis, like in TB lymphangitis, or rarely chronic non-specific lymphangitis. The commonest type of lymphedema in Egypt and in the Middle East and in Africa is parasitic cause, a disease called filariasis. Filariasis is the commonest cause for lymphedema in Africa, and it is due to infection with Wuchereria bancrofti worms. What is the Wuchereria bancrofti worms? Wuchereria bancrofti worm, the life cycle of Wuchereria bancrofti in short. The adult worms live in the inguinal and the pelvic lymph nodes, and the adult worms produce organism called, after coupling, produce organism called the microfilaria. The microfilaria is taken by a mosquito, and in the mosquito, the microfilaria develop into first, second, and the third stage larva. The third stage larva is the infective stage for man. And during mosquito bite, the infective larva is transmitted to the human being. And the larva migrate to the inguinal lymph nodes and the pelvic lymph nodes and becomes the adult worm to repeat the life cycle. Lymphedema may be due to neoplastic cause. Why? Extensive metastasis in the axilla from cancer breast, or extensive metastasis in the inguinal lymph node. From where? From the area drained by inguinal lymph nodes. Carcinoma in the area drained by inguinal lymph node from the lower half of the anal canal, vulva in female, or scrotum in male. What is the pathology of lymphedema? Usually, in about 80% of cases, lymphedema usually in the lower limb, in at least 80% of cases. Less commonly and rarely may affect the scrotum, vulva, breast, or upper limb. This size of the limb, this large size of the limb, is thickening and hypertrophy of the skin and the subcutaneous tissue only. Therefore, the condition affecting the lower limb usually, rarely other sites, and all this size is enlargement and thickening of the skin and the subcutaneous tissue only. The tissue is deep to the deep fascia, never affected by lymphedema. In lymphedema, lymphatic obstruction occurs. This lymphatic obstruction leading to dilatation of proximal lymph vessels, and the lymph stasis in these lymph vessels. Lymph stasis predisposed to repeated attacks of streptococcal lymphangitis, and streptococcal lymphangitis leading to more and more fibrosis in the lymph vessels and the progressive lymphatic obstruction. Lymphedema passes into 4 stages. First stage is simple edema, soft betting edema, due to accumulation of fluid-rich in protein in the skin and subcutaneous tissue. Soft betting, but edema increase markedly after a period of time. Why? Due to marked dilatation of lymph vessels, the lymph vessels rupture rupture leading to lymphoria, escape of lymph in the subcutaneous tissues. Due to prolonged accumulation of protein-rich fluid in the skin and subcutaneous tissue, the protein excites fibrosis in the skin and subcutaneous tissue, leading to hard non-beating edema. Finally, this is the last stage of lymphedema. The lower limb like the limb of an elephant. Therefore, this condition is called elephantiasis. What is the clinical picture and the complications of lymphedema? The complications of lymphedema, first of all, lymphangitis. Recurrent attacks of lymphangitis due to lymphostasis. And from lymphangitis, usually inflammation is spread in the subcutaneous fat. And you all know that inflammation, diffuse inflammation in subcutaneous fat is called cellulitis. The dilated lymph vessels may appear as polyps or bulli on the skin. And this bulli may rupture, leading to lymphedema ulcer, which is very rare. Why? Because diffusion of tissues, nutrition of tissues is normal, in contrast to venous obstruction or arterial obstruction. There is impairment of tissue perfusion and the impairment of nutrition of tissues, leading to ulceration. But in lymphedema, ulceration is very rare because tissue perfusion, nutrition of tissue is normal. Sure, this is the most disabling complication. What is this? Huge disabling limb. Due to chronic lymphangitis, this leads to chronic irritation of the endothelial lining of lymph vessels. Chronic irritation in any disease is precancerous. Therefore, lymphangiosarcoma, which arises from the endothelial lining of the lymph vessels, rarely occur. What is the clinical picture of lymphedema? In Egypt and in in Africa, Western Africa, usually the patient coming from endemic area. In Egypt, area called Dumyat, Giza, Sharqiya, and the patient complaining of progressive leg swelling with exacerbation and the partial remission. Why exacerbation? Severe edema occurs due to severe lymphatic obstruction during the attacks of streptococcal lymphangitis. In streptococcal lymphangitis, nearly there is complete lymphatic obstruction with severe swelling of the limb. And in this stage, there is lymphangitis leading to fever, rigor. This fever is called elephantoid fever. And the limb, there may be red streaks traveling toward the draining lymph nodes. What are these red tender streaks traveling towards the lymph nodes? These are the lymphangitis. Usually in advanced cases, the swelling becomes a hard, non-pitting edema. Why this is not due to venous obstruction, post-phlebitic limb. From the first look, this is lymphatic obstruction, not venous obstruction. Why? Due to this is very important. Presence of deep ankle crease and the sole of the foot is not affected. This is characteristic for lymphatic obstruction. Why? Because the skin opposite the ankle joint has a normal lymphatic drainage. Why? Because the skin in front of the ankle joint drain directly into the ankle joint, into the deep lymphatics. This is one factor. And the skin at the ankle joint is adherent to the underlying extensor retinacular. Therefore, the skin here does not affected by edema or lymphedema. In late cases, this huge disabling limb. This late case is called the stage of elephantiasis, like elephant. Huge disabling limb. The skin is dark, markedly thick, with multiple deep furrows and callosities, warty overgrowth, and usually the inguinal lymph node are enlarged, firm, and tender. What is this? Chronic septic lymphangitis. Sorry, chronically septic lymphadenitis. Sure, in presence of this severe condition, there may be other manifestations of lymphatic obstruction, like where lymphedema of the scrotum or in female vulva. Funiculoepididymitis. What is funiculo? Spermatic cord. Edema of the spermatic cord and the epididymis, which may be acute or chronic filarial funiculoepididymitis. Chylocele. Rupture of lymphatics into the tunica vaginalis. Secondary hydrocele. Chyluria, due to rupture of lymphatics in the urinary tract, and the chyle, which is the lymphatic fluid, descend in urine. Chylous ascites. Chylous ascites due to rupture of lymph vessels in the peritoneal cavity. Or chyluria. Chyle with feces due to rupture of lymphatics in the GIT. Finally, in very, very severe cases, chylothorax due to rupture of lymphatics in the pleura. This is the clinical picture of lymphedema. Let us continue in the next video. Thank you for good listening and good luck.